So let's talk about some hormone therapy truth and what no one's told you about hormone therapy. So I'm going to first start off with some myth busting. Hormones are not contraindicated if you have a family history of breast cancer. Hormones are not contraindicated if you have a history of blood clots, as long as it's not oral estrogen or birth control pills. And hormones in menopause can improve a woman's well-being and lengthen their lives without raising their risk of breast cancer. So now let's talk about risk versus benefits. I have been on hormone replacement therapy since I was 48 years old. I think it is one of the best decisions I have ever made for myself. And as far as risks go, there are little to none associated with hormone replacement therapy if we're working in the world of bioidenticals or living in the world of bioidenticals. You're being augmented with safe and appropriate levels, and you're being well monitored. So what kind of hormones are out there? Okay, so the first thing I'm going to talk about is something called bioidentical hormones. So how are bioidentical hormones different than the hormones that your grandmother and possibly your mother took? So the first hormones that came out on the market were made from conjugated equine estrogens, and they basically took the urine of pregnant horses and they extracted and made hormones out of this, and they put them in a menopausal woman's body, and they had synthetic progestins. There was a study that demonstrated a slight increase in the arm was primarily in the synthetic progestins arm of an increased risk in breast cancer if women took these hormones. The problem with it is they prescribe these hormones in hormone naive women whom had been hormone naive for almost 10 years. And so the age of the patient, the time they started on, the data wasn't statistically significant. All of this was captured by the media, in which the media said a doctor's killing their patients by prescribing hormones. Well, this sent this rampage of misinformation out into the public, and then women pulled back from hormones for a very long period of time. And then we realized that there were increases in osteoporosis, heart disease, all-cause mortality. Lots of bad things came out of not augmenting women at the proper time with the proper type of hormones. So last year, the international conference by the Institute of Functional Medicine was primarily on menopause, which I think is wonderful. And one of the things that I learned in countries that have not-for-profit medical systems, their standard of care is when a woman becomes menopausal is to place that woman on hormone replacement therapy within the first 5 years of becoming menopausal, because we know if by doing this, you're going to lower their risk of heart disease, you're going to lower their risk of dementia, you're going to lower their risk of osteoporosis, you're going to protect their vagina and their bladder. They're not going to be at an increased risk of UTIs and excessive antibiotic use. So let's talk about what types of hormones are out there. So it's kind of like going to Baskin Robbins. There's really no wrong answer as to how you apply them and take them, with the exception of oral estrogen, as long as you're living in the world of bioidentical hormones. So you have patches, you have creams for progesterone, you have creams, you have pills, and you have pellets. I personally take an oral progesterone, a topical estradiol patch, and a topical testosterone cream. Women have estrogen, progesterone, and testosterone in them. And when I say like the ovaries go to live with Jesus, all of these become deficient. So the key to healthy aging is to move well, eat well, and augment what is deficient. So you do have to pull labs to do hormones well. You just can't wing it. There is a lot of science to this. So I've got a quiz on my website. It's Are Hormones Right for You? You can take this quiz and comment what your biggest fear is or your questions are. I would love to answer them, but I do want you to know, and I do want you to hear, that taking hormones in perimenopause and menopause can increase your well-being, your longevity, your health span without increasing your risk of breast cancer.